Hi, I'm Dr. George Blake. I'm Chief Quality and Value Officer for Dartmouth-Hitchcock Health. I don't think any of us have not been frightened by this pandemic and COVID-19. I have seen, over the last month, also good reason to be fearful, and that a lot of the things we might take for granted that we need to do our jobs, personal protective equipment, masks, respirators, things like that, have been in an incredibly short supply. Despite that, there's been an amazing amount of work and excellent work to make sure our first priority, which is keeping our workforce safe. To that extent, we've had to do three things. Number one, take the equipment that's so vital, and this includes eye protection and respiratory protection, because the way the virus is transmitted is through droplets that travel in the air and can hit your mucous membranes of your eyes, your nose, and your mouth. So getting good protection is a combination of eye protection, either a face shield or goggles, having standard masks that provide good droplet protection, and occasionally for situations where there's really small particles generated from someone who's sick, you need to have better respirator protection in something called an N95 or greater. There's been a lot of work across the globe to understand whether, given the short supply of, in particular, N95 masks, whether there's safe ways to sterilize them that would allow them to still function and filter these small particles very effectively. While there's been several methods investigated, the one that has been the most proven and has been implemented the most across the U.S. has been using hydrogen peroxide vapor. It turns out with this well-proven, safe method to sterilize and maintain function of N95s, you can reprocess these up to 50 times and they still function well. After about 20 times, more like 30, there are some aspects of the mask. The straps start to, they're rubber and they lose their elasticity. So most companies, one in particular that got approval by the FDA, are doing 20 recyclings. But now imagine if you have 50,000 masks, and we have around that amount on hand, really good high quality N95s, if you can reuse them 20 times, that gets us to 1 million. So suddenly, having the ability to have 1 million uses of N95s, that puts us in the range of what we believe we'd actually need with some of our worst case scenarios. So it was incredibly important to understand whether we could replicate those processes. They've been well published. It's been done at Yale. Currently is reprocessing and reusing their N95s this way. Mass General is currently doing it. They're using an outside company to do that for them. We had already used this particular process for sterilizing rooms in patients who had C. difficile. And so we know this process, we have the equipment, and we decided it was really best for us to implement our own process. We felt we could do better quality control than trust in someone else, and a team stood up that process, has validated it, and is currently ready to go live with using reprocessed masks in selected areas. That particular process, we think, not only sterilizes it, maintains its filtering, but also maintains its fit and seal on your face.